Hi, everyone. KCO here to talk to you a little bit about deaf culture. So let's first take a look at the cultural terminology. So as you can see on your screen, there's a list of terms that you may have heard when people are referring to members of the deaf community. So not all these terms listed are socially accepted by the deaf community. So what we're going to do is discuss each one and see how it can be used. Okay. The first two terms, deaf and hard of hearing, these are the most common terms used when referring to individuals with hearing loss. The first term is typically used when referring to an individual that is part of the deaf community, uses ASL as their primary language, and they see deafness as a gain. So the individuals that fall into this category prefer to be identified as deaf. The second term, hard of hearing, is typically used when an individual with hearing loss relies more on hearing assistive technology. So hearing aids, cochlear implants, they associate more with the hearing community rather than the deaf community, and they typically don't use sign language as their primary mode of communication. So individuals that prefer to be called hard of hearing sometimes use an auditory oral approach. Okay. The next two terms, little d deaf and big D deaf, we actually don't use these terms when identifying an individual with hearing loss. These are terms that are used to describe cultural identity. So we're going to discuss those more in the next couple of slides. But one thing to note is that big D deaf individuals prefer to be called deaf, and little d deaf individuals prefer to be called hard of hearing. So we'll talk about that in a minute. The next one is a person with a hearing loss. So this is a socially acceptable term for an individual, especially if we aren't sure if they prefer to be called deaf or hard of hearing. The next one is hearing impaired. So I'm going to go ahead and cross that off. Okay, I'm sure you guys have heard this term used often. It's unfortunately an overused term, especially in the medical field, but it's a term we're moving away from and one that is no longer socially acceptable to the deaf community. So what people don't realize when they refer to individuals with hearing loss as hearing impaired is that the term impaired indicates that something is wrong with a person or something that needs to be fixed. And what we're going to learn is that in the deaf community, deaf individuals that prefer to be called big D deaf or that are very involved and close in the deaf culture and deaf community don't view themselves as something that needs to be fixed. So by using this term, it's hurtful. And so this is a term that we no longer use, all right? The next term, moderate to profound hearing loss, this is a term used to indicate the degree of hearing loss a person has. So to describe the amount of hearing that is gone. So they might have a mild loss, a moderate, a severe, or a profound loss. And that, again, is the degree of loss that they have. Residual hearing is the opposite. So this is a term used to indicate their natural hearing level. So this is the level of hearing that they have left when they're not aided. So without hearing aids or without cochlear implants, it's the level of hearing that they have. Okay? All right. So now let's talk about the perspectives of deafness. So there are two perspectives. We have a pathological view and a cultural view. And the pathological view is where people view deafness as a disability or a disease, something that needs to be cured or needs to be fixed. They often see deafness as a negative impact on the individual's life. Someone that might fall into this category of having a pathological view is an audiologist, okay? Because their focus is to find medical treatment to normalize individuals with hearing loss. So by focusing on finding a medical treatment to fix the degree of loss, they hold a pathological view and the thought that something is wrong, something that needs to be fixed, okay? The second is the cultural perspective or the cultural view. So these are individuals that see deafness as a cultural identity, a strong-knit community. They understand and accept ASL as a true language. An example of someone that would have a cultural perspective or cultural view would be a sign language interpreter. They see deafness as a gain. All right, let's get into the cultural identities. So this is what we were talking about in the first slide. So you can see we have big D deaf and then we have little d deaf. So again, this is not a way that we address individuals with hearing loss. So we do not call them big D deaf. The man over there is big D deaf. What we do is once we know how they culturally identify themselves, then we can understand better of whether to refer to them as deaf or hard of hearing, okay? So these terms are used as their cultural identification. And some of the questions that we have to look at is, who are they most comfortable around? Are they most comfortable interacting with the deaf community or the hearing community? How much are they involved in the deaf culture? Do they prefer to be more involved with deaf peers and deaf friends? Or do they prefer to be more involved with hearing peers and hearing friends? Do they use ASL as their primary language? Or do they use an auditory oral approach? Let's see, and then the last factor is their cultural knowledge. So how much knowledge do they have? Are they more knowledgeable in the deaf culture or are they more knowledgeable in the hearing culture? So all of these questions are kind of like internal questions that they ask themselves to figure out how they identify culturally, all right? As you can see, like one of the biggest things that I need you to know is that the degree of hearing loss does not matter. So you can have a mild, a moderate, a severe, profound hearing loss and still identify as big D deaf. Or on the flip side, you can have a mild, moderate, severe, profound hearing loss and still identify as little D deaf. So the degree of loss is not a factor in determining their cultural identity. So for example, if we have an individual with a profound hearing loss, so profound hearing loss, very little residual hearing, but uses cochlear implants, does not associate with the deaf community, is more comfortable in the hearing community, uses an auditory oral approach, they would identify as little d deaf and we would identify them as hard of hearing. On the flip side, you could have an individual with a mild loss. So mild loss uses ASL as their primary language, very involved in the deaf community. No matter the degree of loss, their cultural identity is big D deaf. They prefer to be identified as deaf, okay? So just remember that it doesn't matter the degree of loss. That is not a factor in cultural identity. So just to sum it up, big D deaf prefers to be called deaf. They use ASL and they're very involved in the deaf community. Where little d deaf prefers to be called hard of hearing, they typically don't use ASL as their primary language and they're typically not involved in the deaf culture.